Are you ready to go all in?
Let's do this. Let's do this. Let's do this.
And welcome to the All In Practice Growth Podcast. I'm your host, Shane McElroy, and I'm so excited you're here to join us today. I'm live in location in Dallas at the home of the Dallas Cowboys called The Start. Amazing facility. We're here at the Omni Frisco Hotel right now for an exciting dental CE solutions course called Peak Performance in collaboration with BioHorizons. And we're filming a lot of content out here, but I'm excited to have this guest on right now because we're going to have a fun weekend filming a lot of stuff. But I really want you to get to know our guest today, Dr. Brent Boyse. Welcome to the podcast.
Thanks, Shane. Thanks for having me.
Let's go. Oh, perfect. See, here's the thing. I got a new soundboard, and Dr. Boyse is already better at operating than myself, which is kind of embarrassing for me. But
for some reason, he keeps muting me out. I'm not sure what's going on.
I don't know what's going on. I keep hitting the wrong thing because, whatever. All right. So we're leaving all of this in, by the way. So here's the deal. I've got a story for you real quick. So we've got this course with Dental CE Solutions and all that, and we're checking out the facility, which is the headquarters of the Cowboys, right?
Yeah, awesome.
And so we go upstairs to where the reception is going to be later tonight. And it's this amazing conference room that overlooks like one of the football fields over here. And I was so excited about it. Our videographer, David. So what I did was this glass wall thing. I was going around at the door and looking at him how awesome is this? And as I'm walking, I'm looking and talking, and I literally slam face first into this glass wall. That's how clean they keep it here, folks. They may not win championships anymore, but they keep their glass clean.
Got to start somewhere.
Oh, no. But what's great for you guys, so when you guys get over there later, here's what I want you to do. I want you to go look at that glass because we did not wipe it down. You will see where my nose almost got broken, and you almost had to place implants live on me because I hit 8 and 9 hard, and I thought I was good. They were loose for a second. So we averted disaster. I destroyed some of the Dallas Cowboys property. Sorry, Jerry Jones. He's a big fan of the podcast, by the way. And so I'm excited for you guys to actually get to see the facility now because it's unbelievable. But Dr. Boyse, I want you to take everybody through a little bit, kind of introduce yourself, what kind of practice, what specialty you are, and a little bit about your business.
Great. Yeah, I'm an oral surgeon in the Phoenix Valley. I practice with 6 of the best other oral surgeons on the planet. 2 of them are sunsetting. I joined them 23 and a half years ago. And we've got 3 young guys coming up. And then Dr. Romney and I have been together for almost 12 years. And we have 5 locations, 4 down in the Phoenix Valley, 1 up in what we call the White Mountain region, which is an underserved area, but it basically covers, northeastern Arizona and western New Mexico. So it's got a big draw, but it's a beautiful small town up in the mountains. I've been doing this for, like I said, this will be my 24th year. And we are a full service oral surgery practice, but as a group of 7 strong, we've kind of been able to kind of specialize in the ways that we want to individually. So we've got 2 guys that do orthodontic surgery, and they do about 100 jobs a year, which is not a ton, but it's pretty good for this kind of market. And I've been able to focus on dental implants, especially the full arch aspect of all on X. And then the other guys do kind of a lot of everything.
Sure.
It's been a great experience. I struggled at first making the decision to join a partnership because I thought I wanted to be on my own, but I wouldn't trade these past 24 years for anything.
So that is interesting to me because a lot of people are involved with group practices. Are you guys backed by private equity, or how does that actually work?
We're backed by blood, sweat, and tears. We all slug it out every day, and we have been approached by private equity, but it just hasn't been right for us. We feel like we want to have the autonomy and the ability to make moves quickly and really, honestly, from what I've heard, because I have a lot of friends, one of the first things that begins to struggle in many of those situations is the culture of your practice. And that's something I want to choose who I go to work with every day. I want to dictate what the culture is in our practice. We all do. We work together, to get 7 oral surgeons on the same page might seem like an impossible task, but if it's the right 7 people, it's really easy.
Well, let me stop you there. How did you find those 7 people? And how does that even work? Were you did you start with a single practice with just you, or take me through that story? How does that develop?
Yeah, our practice was started by Dr. Brinks Austin back in 1992. Him and Brad Porter, the second guy that joined, they became friends in dental school. One went to Bama for residency. Brad stayed in Iowa where they did dental school, and he started out in, I'm trying to think where he was, but not in Phoenix. Brinks went back to Phoenix because his wife was there, and after a couple of years of talking, there was another practice that went up for sale, and so Brinks called Brad, and they bought a second practice, and I joined them about 10 years later, and at that time we had 2.5 locations. And then
Wait, what is a half location?
well, it was a multi-specialty office that we didn't outright own. It was owned by the group of specialists, and
Gotcha.
endo was there, and ortho and perio, and eventually that model didn't work for us, so we stopped that location and started another practice in the valley, and then we bought out another retiring oral surgeon years later to make 4 in Phoenix, and then we were requested by what we call the White Mountain community to come help up there because we were seeing them. They were 3 hours or more away from the valley.
Yeah.
And so we opened up a practice up there. That's our newest location.
Excellent. So is the plan to open up more and more practices, or are you guys kind of good for a minute? That seems like a lot of work.
It is. It's a lot of work. And like you said, how do you find those 7 people? It's not easy to find 7 like-minded individuals
it's
who
definitely
are
not.
all for the,
It's hard to find two.
yeah. We feel blessed to have who we have. And I think, with this current market, you bring up private equity. I think we have a really good, net. And we've got, like I said, 3 newer guys coming up. And then, I'm hoping to practice another 10 to 12 years. And Dr. Romney's behind me a few years. And so I think we're in a good spot. And we're happy where we're at. We have fun together. We see a lot of patients and have an awesome team.
So to have 7 practices too, to have consistent results, right? You've got every practice dependent on each other. That's the one thing about DSOs and things like that. What I think is forgotten a lot of times is every practice is an opportunity and yet also a liability, right?
Yeah.
So if one person or one practice is not holding up the standard that all the other practices want to hold to, really pull you back, right? So how do you guys, is there systems that you put in place? Like, how do you stay consistent there?
Yeah. So our reputation, our brand, back in about, it's probably '07, we were invited to a specialized group. And back then it was called the Untouchables. And it was essentially the beginning brainchild of what today is peak performance. And what we learned from our mentor, Dr. Lee Walker, was how to take an oral surgery practice and implement systems and run it like a business.
Sure.
Take things that work well, things that you can measure, watch your numbers, watch your analytics, do more of what works, do less of what doesn't work. And that led to systemization of everything in our practice, from purchasing to marketing to training to hiring to firing to our education and marketing and even
which
our
makes
model.
sense why you can have 5 practices.
Yeah.
Right. Yeah. So otherwise that'd be, running one oral surgery practice is tough enough.
Yeah.
Running 5 is got to be a chore.
But it's not running 5, it's running 1 5 times.
There you go.
Right? That's what scalability is. You
That
take the
makes a lot of
systems that
sense.
are working, you put it in a new location, plug the players in, they run the playbook, and you can do it over and over and over.
Repeatable and scalable. That way,
Yep.
right?
Yep.
That's brilliant. So those are the things that you teach in peak performance.
Exactly.
So let's kind of high level. What is peak performance? Who it's for, and why you do it?
So let's start off with why we do it. So Gary Morris and I, we run Peak Performance now, and originally it was just for surgeons, and Gary was actually with Dr. Walker when I was in the group, and later I took over teaching. Tom Stone took over the East Coast. I was doing the West Coast, and then it shut down for a while, and then Gary and I started it back up, and then we've every time. Every round it changes, right? Each
Sure.
iteration, because we adjust to market and market pressure. And one of the things that, so I teach business skills and the systems. Basically, I share my systems with these surgeons, and we learn about business principles, business models, what the systems are, how to implement them. And then they go home for 6 months and they implement a few systems.
Sure.
We get back together 6 months later, that second session. I teach them more systems, but this time they bring referring doctors with them.
Gotcha.
And then Gary runs a very successful prosthodontic practice. He's got a general dentist in his practice, but he does everyday trench style dentistry.
Absolutely.
He's not just a prosthodontist that picks and chooses. He's in the battlefield with us. And so he then teaches the general dentist systems in their practice, from hygiene to scheduling to, how many appointments to do this and that. And then they leave and go home. And part of that homework assignment that time is to find treatment coordinators. Because
Huge deal.
Gary and I believe in the team approach to dentistry, right? Everybody
Absolutely.
should do what they're best at.
Well, especially you said you do all on X. Like if you don't have the team approach in that, that's a problem.
It's a lot of risk.
Mm-hmm.
It's a lot of risk for a provider, but it's also a lot of risk for a patient.
Absolutely.
And so, I love practicing in a model where I know that my restorative specialists, whether it's a general dentist or a prosthodontist, they have my back. My lab has my back. And no matter what we come across, because not everything is perfect,
Yep.
we have the team to approach it in the best way to get the best outcome very, very consistently.
That's awesome.
And
Well-
just to finish up
yeah.
that third session, so the homework assignment is to get coordinators. Then we bring those coordinators back in session 3, and we train the restorative treatment coordinator as well as the implant surgical treatment coordinator individually and what their responsibilities are. And then we also train them how to work together.
Absolutely.
And then they go back and they implement that.
So what's interesting about peak performance, and then I want to get into a little bit kind of the mini residencies that kind of seems like the next step after peak performance. When I first got into implant sales many, many years ago, I heard of the Untouchables. I'm like, who are these guys? I didn't have any of them as customers, obviously, because I didn't work for Biomet at the time, right? And the interesting thing was I found out through PJ Shaner, who's, I think he's CEO or one of the heads of Beacon Oral Surgery, one of the biggest group practices out there.
One of the best surgeons in the country, too.
PJ is amazing.
Yep.
But their success, and they're like, oh, we're part of this group. This is what we do. It's systematic. And it's funny, I copied some of those things and tried to do them my way, bring in speakers and I couldn't pull it off, right? But when I got to, I used to be at ZimV, and fortunately I got to see, the growth of many of these accounts. And I didn't know you, and I didn't know Gary. But what I did see was that the ones that were following these systems and were doing the mini residencies after kind of the peak performance or Untouchables, or what you called it, was that year after year, it would be like, they're up 100 implants, and then 100 implants the next year, and then 100 implants the next year. It was consistent year over year over year over year. And I validated that. I go, well, they could just be switching more implants over to us. I actually reached out to some of the doctors because I want to see, is this real? It's a real thing. And so before I ever met you guys, I got to hear and see about the actual success that you guys have given to other practices over the last couple decades, really. Really cool.
Yeah, it works. It works. As long as you're willing to put the work in and run the playbook works.
Okay, so you've talked a little bit about peak performance, and you're not going to give all the secrets of peak performance or all the systems, but that's implementing systems in the oral surgery practice, then kind of training the referral in a sense, and giving them systems and how to work better as a team, and then bringing in the ITC or key players in the practice and working all together as a team. Now, I've heard of the mini residencies. Take me through what that is and why, what happens there, what's the outcome, and what's the hope that happens.
Yeah. So one of my marketing systems that we use in our practice, and it's the best marketing system, is education.
Sure.
I started out my career. My best friend one of my best friends is a general dentist, and he drugged me along to CE. And I did Frank Spear and I did Frank Coy, John Coy's and those courses. But when we started the mini residencies, that was one of our homework assignments that kind of came out of the Untouchables. And basically what that was is it's a 4-part series that we do once a year. Sometimes we are running 2 at a time. We've run 3 at a time in the past, because we're either focused on a topic, whether it be full arch, or we've got a younger group, and we've got our legacy group that they kind of are 2 different levels.
Yep.
In the beginning. But we bring in a speaker, And so today, the speakers that we use are trained and calibrated through Dental CE Solutions.
Okay.
Because as you said, if you don't run the program in a very specific way, it just doesn't work. It doesn't work the same. And one, question that I get for surgeons that are thinking about taking the Peak Performance series is, well, I did education. I just finished a course with X implant company and it was a waste of my time. And it was, and so one of the systems is how to run this, how to monitor it, how to do it successfully. So we bring in a speaker that's been calibrated and we sign
And hold on, to interrupt you real quick. By the way, there has been a number of implant companies, and not to dog any of them, I won't name any of them, that tried to copy it, but could not figure out how to do it successfully.
Yeah.
Like over the years, I've seen it with 5 different companies, legitimately.
Yeah. And some of those speakers used to speak for Dental CE Solutions and they're trying to kind of spin it off, but there is a secret sauce and there's a recipe and that's what we teach. And so we find a speaker for the year. We basically go out and we recruit people. And for us, some of our attendees have been attending these courses for more than 10 years.
Yep.
So at the end of the year, they're ready to sign up for the next one because they
Or are they
know-
learning the same thing, or is the topics changed?
Well, the topics change according to the needs of our practice. So our speakers are good enough to where what we do is we say, look, we want to talk about this in this session. And so at the end of each year, we have our education committee, which is part of our top referring dentists. And we say, okay, what topics do you feel like you need more education on? And then we match the speaker with those topics. And so, but that's a small part. That might be 20 or 30% of what is talked about in those courses. The rest of it is case-based education because we bring cases as a group to each of these meetings. And
Are these like cases that everybody trains on the same one, or are these like real cases?
So these are real cases. So if for example, my brother's a dentist, if he's signed up for our course, which he's been signed up for our courses every year since he was a second-year dental student.
Yep.
If he sends me a patient, we document it and we put it in a folder. And when it's time to go to our course, I grab the drive, we go, and either I have it prepared, but now he has it prepared because he's like way beyond me. He brings, he's got digital scans, he's got wax ups, he's got all that stuff.
Oh, nice. Wait, so you're telling me you're getting, let's say, all right, I'm assuming you have one like, okay, these are new referrals. They maybe just need to learn how to identify single implants, but they're going through their own cases, bringing those actual cases. Treatment planning, is this as kind of like a group?
As a group.
And so I would assume that by doing that, they basically go back and say, call that patient back, or the next time they see that patient say, hey, by the way, this is your new treatment plan for your implant or whatever the best treatment is. Is that correct?
So our treatment coordinators come to that course and we each have our own coordinators. So if it's one of my doctors that presents, they take notes of what the treatment plan that we end up with. And it's not just the treatment plan, but it's how do I present this to the patient if there's a question about that, or how do you feed this out, or let's get the timeline set, who sees them when and how long. And then Monday morning, that treatment plan is waiting at that dentist's office when he gets there so that him and his treatment coordinator can now present treatment to that patient.
So I see that as a win-win. So you're getting educated, you're identifying more. So because a lot of times you don't even, if you don't see it, you don't know what to tell the patient, right?
Yeah.
So you're getting them revenue now because now they can effectively treatment plan that case, identify it, and then present it, I would assume.
Comprehensively.
Yep, comprehensively.
Yep.
And so I would assume it's also not about just about implants, right? It's about everything, right?
Yeah, sometimes it's ortho first, sometimes it's endo, perio, whatever the patient needs, but it's how to look at this patient holistically instead of doing one-tooth dentistry, which sometimes is hard. We dentistry is such a treadmill, if you will, and sometimes you're just trying to make it through the day and you can get hyper-focused on one tooth. But not every patient, if patient comes in, they only have one tooth problem, that's okay.
Sure.
But if it's not, then that's a resource for us to take a minute, take a time out, document it, step
They
back.
may treat one tooth thinking that's the problem. I'm going to fix this one problem here. We're not realizing it was the occlusion. That was the problem from an adjacent to, or whatever that may be that's actually causing the problem. So I actually think that we probably have to, one tooth dentistry has probably gotten a lot of full arch cases down the road, unfortunately, at some point.
I was just reading an email from one of my partners who, one of our referring docs sent a case, and one of the surgeons in our practice had placed 3 implants. Well, when the dentist took a step back and looked at it more comprehensively, we realized that this is really a 2-arch hybrid case.
Yep.
And so now these 3 implants that have been placed have not been placed in the right location for a hybrid.
And patients never understand that.
As much as we focus on comprehensive treatment planning, sometimes we can even get referral focused, which focuses on one tooth. And we're assuming that the dentist has gone over a comprehensive plan, and many times they haven't, because they were seen as an emergency, and they just say, go see EasyMax. And so it's a constant reminder that we really have to look at the patient holistically and address all of their needs, and at least have that conversation with them so they know what they have, what it means to have what they have, and what the solutions are available to them.
That's awesome. And so that makes a lot of sense why you could do this for a decade now, because, all right, we're talking about this year, we're going to review, or this 6 months or whatever the time period is, we're going to review these types of different cases or whatever you bring in, and then you level it up to maybe full arch at some point down the road, right?
Yeah, whatever. And think about the same patient 10 years ago and today. How has the technology changed?
Yep.
Like the materials, the methods, the digital
100%.
aspect, how we approach cases. I because we have these cases documented, because we also continue to document them through the process, and then we keep presenting updates.
Nice.
But what we were doing 15 years ago is almost embarrassing. But at the time, it was the best there was.
By the way, I heard this great quote. If you're not embarrassed by what you did 5, 10, 15 years ago, it means you weren't putting forth the effort to try and move forward. Right? That's actually, if you're embarrassed by what you did 10 years, that's a great thing, by the way.
Yeah.
That means you've improved. So, but that's excellent to hear, to see the background of what you guys did before, where I could actually see the real numbers and see the growth that these practices were having. But then getting to meet you guys later, we got to do some let's talk a little bit. The Smile Today course, it's MV, right? We worked together on building that course with Dr. Morris, which I think he's teaching one right now, actually.
He is. He's late.
So call that Gary Morris,
He's
GST,
always,
Gary Standard Time, right?
Well, he's always flying from one education event to another. Gary's the best dental educator that I have ever been around.
He's pretty damn impressive. He flew in. I remember his flight got delayed. It's the first time I ever met him at a course. Super nervous, right? And his plane landed at like 4 a.m, and he had to lecture at 8 a.m. And I'm like, I haven't met with him. Like, are we going to be okay? And he crushed. Yeah. Like, I'd never seen anything like it before.
He controls the room.
It's wild. On no sleep at all. I can't do that.
Yeah.
So, all right. I want to move to another topic. Word on the street is, and this is this street right out here, says that you got a new podcast coming out.
Yeah. So everybody's got a podcast. Everybody wants to.
If I have a podcast, literally anybody can do a podcast. So
I've had this frustration for years, and I feel like it's getting worse in dentistry, where there seems to be no consensus on in implant dentistry of what the standard of care is.
Mm-hmm.
I think single tooth cases are a little easier to define.
Sure.
Full arch has become very hard to define, because you've got people that are just out of dental school doing surgery and restorations. You've got people like me that have been doing it for decades, and it's being done at all different levels. And technology is great, but sometimes technology can be used to mask a lack of experience.
Sure.
And then you've got the commercialization, where you've got these centers, and people are being sold, printed finals with no metal at all in them, direct to MUA as a final product, which is at the same price as what we're producing, which is always with the titanium bar, zirconia, or long-term PMMA.
I have a real problem when they do that as well, because they don't inform the patient, and unfortunately, a lot of marketing companies have kind of pushed that, and I don't think that's a positive thing at all.
Yeah, and for these poor young providers that are getting put in this situation, they don't know the tsunami that's actually headed for them. Because when you do a bunch, Now you have things that start to break in 2 or 3 or 4 years, and you've offered a lifetime guarantee, and you've been told, well, you just print a new one and stick it in. Well, that's easy if you've done 10 cases, but if you've done 100 or 200 or 300, there begins to be a problem. So anyways, I thought, I really want to make a forum where we can talk about dentistry at the very highest level.
Yep.
And the name of my podcast is The Perfect Implant.
I'm guessing this has to do with systems too, right?
Yeah.
I love it. I'm the least systematic guy, and you might be the most, and I have a lot to learn from you.
It does. But really, there is no perfect implant, right? Because the perfect dental device is a tooth.
The pursuit of perfection.
Right. And so the idea is to invite practitioners and have them bring their favorite case or two, and then have them present that case and just tell us why they loved this case. What about it went well? What was done? So that we have kind of a repository of cases and experiences so that these younger practitioners have something to compare. Because if you're in your office all day long and you're just doing the best dentistry you can, and you're not working with other specialists or other providers, you think what you're doing is the best there is.
Because you have a singular perspective.
Yeah. But if you take a step back and go, well, what's everybody else doing?
Sure.
And one thing I think that's universally true is the longer you do something, the more you know that you don't know what you
exactly.
thought you know. And it feels like you know less as time goes on.
It's funny how age is humbling experience.
Yeah.
And experience is a humbling experience.
So that was the basis of the podcast. And I want to have a little bit of practice management, because that's something that I love, the business side of it, as well as kind of their cases. And then like our first episode actually is on private equity and the pros and cons of
Love
that.
it.
And so
that'll be a very popular episode. I can guarantee it.
Yeah.
So when will this fully release?
We're trying to, if you've ever done a podcast, you kind of want to have you want to have some episodes.
You want to get it
canned,
at least about 5 usually. Yeah.
Yeah, especially because lining up guests and all the logistics of that, you want to have a regular release. And so our goal is to release our first episode in the next 2 months.
Excellent. Well, I'm looking forward to that, because when it happens, you let me know, because I'll promote it, and we'll hopefully have you back on again. Maybe we'll do like a co-branded episode or something too, where you can help me again set up the board that I couldn't even figure out my own board. So I think you're going to do just fine at podcasting, by the way. And especially for you younger guys out there, I would take advantage of this, because this sounds a lot of like some of the tools or the insights that you're going to give in some of these courses, or even in the mini residencies, but kind of very specific on one case at a time. And if you have an upcoming case like that, that could be ultimately very helpful for you, especially if you need more reps, and maybe having a different perspective could help guide you in the right way. Correct?
Yeah. Another frustration that I've seen in my career is I can place the exact same implant in 3 patients, perfect depth, perfect angulation, great soft tissue. And depending on the restorative doctor and the lab they use, the patients can get you could have a ridge lap on one, you could have margin showing through the tissue on another. And then I see the patients back, and in my mind, I'm thinking, well, if they would have went to one of these providers, that would have been a very good result, but they didn't have the best result. And that's not a conversation I can have with the patient, right?
No, that wouldn't go well.
And so it's about seeing what's out there, seeing what other people do, and just continual learning to be and do the best that we possibly can for our patients.
All right. Well, we've got a reception we got to go to in a little bit, but I've really enjoyed this. But there's one last question I have for you. What is this this train station or something that you own? Because I've heard of some train stations before, but I want to hear about what you were talking about.
That's a joke that I have with my son-in-laws when they came to ask me for my daughter's hand in marriage. I listened, and I just said very dryly, "If you hurt my daughter, I will kill you and bury you and take you to the train station."
I'm a little nervous right now, the way you said that. I think he actually really means it.
What wouldn't you do for one of your daughters?
So obviously
there are no limits.
Oh, well,
no
obviously
bounds.
Kids are everything, but somebody's been watching Yellowstone, huh?
Yeah.
Give me 1 second. I'm going to be right back. Nobody move. I'm going to run. I got to get for you real quick.
Yeah.
This shield.
So one of the things I do, I have a hobby ranch. It's just 55 acres, but I've got, in my free time, I spend digging holes and on tractors and building fences and
digging holes, huh?
digging holes. You never know when you need a hole.
Well, I'm not going to touch that one. For an implant. Yeah. So I made this for you because of that. So you can show this with the shotgun and the train in the background, so they know where the real train station is. If anybody messes with your daughters, that's for you. So let's show that to the camera real quick. Let's do it of that.
Let's see. That's
a gift from All In Practice Growth right there. You look good. You should be a cowboy.
Yeah, well, I do have cowboy gear.
Let's go. I
grew up on horses, but
well, I'm gonna have to go check this out. Play with some of these tractors.
Yep.
Maybe bury some bodies in some holes.
Lots of fun.
Got 55 acres. I think we were talking earlier. You get caught nowadays. It's your fault. But Dr. Boyse, really enjoyed having you on the podcast. I don't want to keep you any longer because you got your reception. But I'd love to have you again. I'm really looking forward to hearing about the Perfect Implant podcast. We'll definitely co-brand that, co-promote that, whatever you want to do with that. But when you guys see that come out, make sure to check that out. Now, for anybody who wants to get in touch with you, maybe is interested in peak performance, who should they contact? Where should they go?
If you're interested in peak performance, it comes in a couple different ways. We've got 2 implant companies that co-sponsor courses for us.
We can say it out there. It's MV and BioHorizons.
Both. They have co-sponsored courses, but even just go to the website, the dentaleseSolutions.com.
Okay.
And just reach out. I mean, we've got, that's not the only type of education we have. We have education, hygiene, legal, anything you can imagine we can put together. And even if it's not listed on our website, we can find speakers.
That's awesome.
And because of Gary and his connections and Shelly and Jody, we have access to some of the best educators in the country.
Well, that's amazing. And thanks for having us out here with you. I'm really enjoying this. I'm looking forward to a fun weekend and learning from you as well. And guys, we'll catch you on the next All In Practice Growth podcast.
Thanks for listening to the All In podcast. See you next time.